Chapter 17 of ICD-9-CM classifies injuries, poisoning, and other effects of external causes, complications of trauma, and complications of medical and surgical care not classified elsewhere. Because we have to get to ICD-10-CM, we will only cover Chapters 26, Injuries, Chapter 27, Burns, and Chapter 28, Poisoning and Adverse Effects of Drugs. You will be responsible for reviewing Chapter 29 on your own. Here and in your textbook is a breakdown of the subcategories for coding injuries. The primary axis for classifying injuries is the type of injury as indicated in the previous slide. The second axis is determined by the anatomical site. Inclusion and exclusion notes are used extensively in this chapter, some of them long and complex, so it is important to pay close attention to all guidelines and information provided. Also, fourth and fifth digits are provided for many categories to indicate a more detailed anatomical site or to provide more information regarding the injury. If the patient has suffered more than one injury, each injury should be coded separately, unless a combination code is provided. Multiple injury codes should not be assigned when documentation permits more specific code assignment. As we've discussed before, the word with and the word and are used in a specific way in ICD-9. They are used a lot in Chapter 17 with the word with, meaning that both sites mentioned in the diagnostic statement are involved in the injury. The word and is interpreted as meaning and, or, it can mean or. In other words, either or both sites are involved. When coding injuries mentioning the fingers, this usually takes into account the thumb, but there are a few separate codes for injuries of the thumb, so pay close attention when coding these areas. Terms such as condyle, coronoid process, ramus, and symphysis refer to the specific portion of the bone involved in an injury and not to the bone itself. If admission is due to an injury and several injuries are present, the code for the most severe injury is designated as the principal diagnosis. If the diagnostic statement is not clear on this point, the physician should be asked which to code first. External causes of injury and poisoning codes E000 and E800 to E999 are used with injury and poisoning codes to provide information about how an injury occurred, the intent, was it accidental or intentional, the place where the injury occurred, and the status, was the patient military or civilian at the time the injury occurred. In the case of a person who seeks care for an injury or other health condition that resulted from an activity, or when an activity contributed to the injury or condition, activity codes E001 to E030 are used to describe the activity. This will make more sense as you complete the practice exercises and look through this section on E-codes. Injuries are a major cause of mortality, morbidity, and disability, and cost of care related to these conditions contributes significantly to the increased cost of health care. Reporting E-codes provides data for injury research and evaluation of injury prevention strategies. In other words, E-codes are primarily used for data collection and not for reimbursement purposes. Although reporting external cause is optional, unless mandated by state or insurance carrier regulation, healthcare providers are strongly encouraged to report E-codes for all initial treatment of injuries. The selection of appropriate E-codes for injuries is guided by the index to external causes and by inclusion and exclusion notes in the tabular list. The index to external causes is located in Section 3 in Volume 2. In the 2015 edition of ICD-9, this begins on page 334 of Volume 2. Note that in the official coding guidelines in Section 1C, under Chapter-Specific Guidelines, E-codes are covered in Chapter 19. This is located in page 25 of the Coding Guidelines section. A code from category E000, External Cause Status, is assigned to indicate the work status of the person at the time the injury occurred. A code from E000 would be assigned with other external cause codes such as transport, accidents, and falls. E-codes are always used as additional codes, never as the principal or first listed diagnosis. Do not assign code E000.9 which is unspecified external cause status if the status is not stated. Assign a code from categories E001 to E030 to describe an injury that caused or contributed to an injury, poisoning, or other health condition. These codes may be used with other E-codes for status, E000, and place of occurrence, E849. Coders should not assign code E030 unspecified activity if the activity is not stated. As I've already mentioned, E-codes are not used as the principal or first listed diagnosis. If two or more events cause separate injuries, an E-code should be assigned for each. If the injury is due to two or more external causes, the code for the direct cause is listed first. Look at the examples shown here, and also take a few minutes to review the other examples provided in your textbook. Listed here and in your textbook, you see the sequencing hierarchy you should follow. For instance, abuse takes precedence over all other E-codes, and so on. When a transportation accident involves more than one type of vehicle, there is an order of precedence as you see here. This information can also be found in your code book at the beginning of the section for transportation accidents. No general rule governs priority for other E-codes. Be sure to follow exclusion notes carefully. A transport accident, E800 to E848, involves a vehicle used for conveying goods or people. Notes and definitions are provided in your code book at the beginning of the section. Separate external cause codes are provided to classify the external cause of injuries resulting from accident, self-harm, or assault. If the intent is unknown, unspecified, suspected, possible, or probable, a code from categories E980 through E989 should be assigned. When the condition code from the main classification is a late effect of injury, the associated E-code must also indicate a late effect. Take a minute to review the example shown here. Hopefully you remember the discussion on late effects in the musculoskeletal chapter. I've included the instructional video again in this module for your review and to refresh your memory. Also, remember to use the alphabetic index to external causes located in Volume 2, beginning on pages 334 of the 2015 edition, looking under main terms such as accident and late effect of for the appropriate E-codes. ICD-9 also provides external cause category E849 place of occurrence codes for use as an additional code to indicate the place where an external event occurred when the place of occurrence is not implicit in the injury or poisoning code. Note that codes from this category refer only to the location, not to the activity or the injured person. Separate codes are provided for the activity and status. Refer to the example shown here. When the place of occurrence is not specified, a code from E849 is not assigned. Make sure that an E-code is needed. Be careful that you don't get E-code happy, as I call it. When looking up place of service codes in the E-code alphabetic index, refer to the main term accident, subterm occurring at or in, then the location. In the example shown here, the subterm for location would be public building. Expanded codes for child and adult abuse facilitates the gathering of more specific data. Subcategory 995.5 describes child abuse with a fifth digit indicating the type of abuse. Keep in mind that codes for child and adult abuse are assigned only when the physician documents abuse. Coders should not interpret the narrative descriptions as abuse without the physician's confirmation. ICD-9 does not specify the age limit for the assignment of child abuse codes, 995.50 to 995.59, versus the adult abuse codes, 995.80 to 995.85. Code assignment would be based upon the age of majority, which varies from state to state. In some states, an emancipated minor is considered an adult. In some instances, when it is not documented, the provider will need to be queried to determine if the patient is an emancipated minor. When the cause of injury or neglect is intentional, child or adult abuse, the E-code should be listed as the first E-code. Report category B15 to indicate past history of physical or psychological trauma. Counseling codes for victims and perpetrators provide more specificity regarding the person receiving counseling. Fractured are classified in categories 800 to 829. Three-digit categories indicate more specific sites within these broad groupings. Fourth digits usually indicate whether the fracture is open or closed, and fifth digits usually indicate a more specific bone within the general site. In an open fracture, an open wound that communicates with the bone is present. You may see terms such as compound, infected, missile, puncture, and with foreign body. Closed fractures do not produce an open wound. They are described by terms such as comminuted, depressed, elevated, green stick, spiral, and simple. A more complete listing can be found in the notes at the beginning of the coding manual section on fractures. Any fracture not specified as open is classified as closed in ICD-9. Occasionally, a diagnostic statement contains terms that relate to both open and closed fractures. In this case, the code for the open fracture always takes precedence. Here you see a list of fractures and the categories associated with them. Category codes 810 to 829 classify fractures of the extremities. The fourth digit indicates whether the fracture is open or closed, and the fifth digit provides more specificity as to the portion of the bone involved. Combination codes are provided for certain sites, as you see here. For instance, category 813, fracture of radius and ulna, is considered a combination code. Also, be careful to pay close attention to any notes provided throughout this section. As we've discussed previously, when coding late effects of injuries, the residual conditions such as malunion, non-union, deformity, or paralysis is sequenced first, followed by the cause of late effect code from categories 905 to 909. A late effect E code is also assigned. A current injury code is never used with a late effect code for the same type of injury. Malunion implies that the bony healing has occurred, but the fracture fragments are in poor position. Non-union, on the other hand, implies that healing has not occurred and that there is still separation of the bony structures involved in the fracture. Chapter-specific guidelines for coding traumatic fractures and the corresponding E codes should be reviewed carefully. Patients who have had fracture reduction usually require aftercare for removal of wires, pins, plates, or external fixation devices. In addition, patients with orthopedic injuries still in the healing stage may be seen primarily for conditions not related to the injury, but with some monitoring or evaluation of the injury. B codes are provided for these situations. B codes are also provided to indicate an orthopedic status when it is significant for the episode of care. Here are some other injuries that are encountered. Dislocation associated with fracture are included in the fracture codes. When a primary injury results in minor damage to peripheral nerves or blood vessels, the primary injury is sequenced first. Superficial injuries include things such as blisters, abrasions, and friction burns. Open wounds such as lacerations, puncture wounds, cuts, animal bites, avulsions, and traumatic amputations that are not associated with another injury are classified in categories 870 to 897. Fourth digits for categories 870 and 871, denoting eyeball or ocular adnexa, indicate whether the wound was a laceration or a penetrating wound. Codes for penetrating injury of these sites indicate whether a foreign body is present. The fourth digit for other codes of open wounds indicate whether a complication is present and may also indicate a more specific site. It is important to understand that an open wound is complicated when any of the following conditions is present: delayed healing, delayed treatment, foreign body in the wound, or major infection. When listed as a diagnosis, traumatic amputation is classified as an open wound in ICD-9. Be careful though, the term amputation is also used for an amputation procedure, which can be performed for a variety of reasons other than the treatment of trauma. Certain early complications of trauma are not included in the code for the injury. These are classified in category 958. The fourth digit indicates the type of complication. Usually codes from category 958 are assigned as secondary codes, with the code for the injury sequenced first. Categories 950 through 995 classify other and unsuspected effects of external causes resulting from exposure to heat, cold, and a variety of other conditions due to external causes that are not classifiable elsewhere in ICD-9. We finished our review of codes for injuries. Remember, there are additional instructional videos provided in this module which discuss questions about E-codes and late effect codes. I hope you have a great rest of your day, and remember to carve out a little time just for yourself.